Yeah, everyone, Nanami here. In 2022, I was asked to travel across Lutruwita and record our community's stories of quitting smoking. I heard so many great success stories of our people who managed to quit and got a good picture of why our people chose to quit, how they did it, and what supports they were able to access along the way. This is the Makara Patapa podcast.
Hi, I'm Stephen Picken from Hobart. I'm currently training to become an Aboriginal health worker. I knew I always wanted to do something to help support my community and give back to them because I've received so much help over the years from the community. But I never thought I was able or smart enough to go to TAC or university or anything. And it wasn't until Sarah Maynard pushed me to do the training course that I took. And the 3 months training course, it just really opened my eyes and made me discover that helping my community and doing clinical work is what I really want to do. I started smoking about 10 years ago when I was 18. I was working in hospitality. I was working 12-hour shifts without a break pretty much, but people who smoked got to go out multiple times a day, so I thought to myself, I'm going to start smoking so I can get more breaks in. And that was just really the undoing of me. And then I've been like a pretty big chain smoker for about the last 10 years. Smoking is something that I've always been around. It's been a big thing in my family growing up. I had a lot of mates and friends that had done it, so I just found it quite easy. If I was on smoking tailor-mades, I'd smoke about 20 a day. But if I was on pouch tobacco, it was probably double that. Considered quitting for the last few years because I have an uncle who had to have a double lung transplant because of smoking. My brother had his lung collapse because of smoking. And so in the back of my mind, it's always been there, you need to quit for your health, but it wasn't something that actually had sunk in until recently. I had the opportunity to be employed as elder support for an elders trip with our community, and I didn't want to be smoking around our elders or having my attention away from them because I'm running off to hide around a corner to the smoke. So I took some patches and some gum from the doctors here and I tried it for the week. Now, originally, I was only going to do it for the week. But then by the end of the week, I found it so easy, well, not so easy, but it was quite easy to go the week without smoking. And then I thought, well, I might as well keep it up because if I can quit for my elders, I can do it for the rest of the community because I didn't want to become a health worker and preach to people to live a life and then go home and chain smoke a packet of cigarettes. It's just so hypocritical. When I originally spoke to the doctor about them, Dr. Tash had given me a lot of advice and advised me what products were the best and how to use them, and then I just went about it my way. Yeah, so I wore 24-hour patches and gum, and I used those for about 2 months, and then I just stopped using them and haven't really had any trouble since. Decided to start taking them off during the night because they had given me pretty vivid dreams, not nightmares, but they were very vivid dreams that had me waking up in cold sweats and sort of terrified. After a month, I stopped using them at night, and then I'd put a fresh one on in the morning. And I used to chew a piece of gum about every hour, and then I just stopped one day. For the first couple of weeks, I actually avoided all my mates and any family members who smoked because I didn't want to be around them in case it made me jump back in relapse. It was quite difficult because whenever I'd ride my motorbike, as soon as I'd get off the bike, it would be a cigarette. So it was trying to find something to replace the cigarette with after getting off the bike. So I bought a packet of lollipops and just set in my motorbike bag. So every time I'd stop to get off the motorbike, I would have a few licks on a lollipop. I tried to quit once before. I lasted probably 5 hours, but it was pretty hard, pretty horrible, and I caved in pretty easily. But this time around, I think I was in the right frame of mind this time to actually kick the habit. I've been smoke-free for 120 days. My asthma isn't as bad. I used to, every couple of days, I'd be huffing away on an asthma pump, but I haven't had to use it in the last 2 months. That's been a huge difference, really, just being able to breathe easily. I'm not strapped for cash, and I'm not borrowing money off people every few days to buy smokes when I'm out of cash. So I've really noticed that I've actually finally been able to start a savings account and start saving up possibly for a house deposit or something. Yeah, just try it. Try your best. Even if you don't quit this time, it's something that will help you down the road when you're ready to quit.
Thanks for listening to the Makara Patapa podcast, a podcast series by the Tasmanian Aboriginal Centre with support from Public Health Services Tasmania.